Aaron and I came in to the fixed therapy to get fixed. So, John, tell us how you're different than others.
Well, this isn't your everyday uh, day spa. What we focus on is soft tissue manipulation, in the sense of not just massaging someone, but being able to teach somebody how to be truly relaxed, how to teach them how to internalize what's going on and be able to allow their body to be moved and manipulated. It's about freedom in there versus stiffness. Before we started, he wouldn't let me pick his arm up. He wouldn't let me work on it and move it. Is that right? Mm-hmm. Now he's learning how to allow his arm to move or body to move without having to be in control of those movements. When's the last time this arm moved without him using the muscles to move it himself? So he's going through what we call passive range of motion, and I'm doing the same movements that he's usually in control of. Same sense of if you take a deep breath, that's a conscious decision that you allow your body to do. Normally, you just take breaths without thinking about it, just like we have tension without thinking about it. This allows we are teaching the body to take that deep breath, let go, be able to allow it to be moved, manipulated, without the sense of control. Teaching, first off, awareness, range of motion, letting these muscles slide and glide instead of them being, worked like this. His muscles are more like that. So we're getting in there and working on them, getting them to move, glide, slide amongst themselves, not be stuck to each other, what we call as adhesions or deep fascia or the fuzz in the body. So before we started, he wasn't getting this motion and movement. Now we're teaching him how to do that. And we can do it through the clothes. It doesn't need to be some spa visit where we don't do that kind of stuff. We're getting into the body, we're working on it, and helping people understand where they're holding tensions, where their posture, how they stand every day, and educating them on their abilities to not work so hard doing nothing. Other techniques we use today was a little bit of cupping. He mentioned that he was waking up in the middle of the night because of his hip, and so we did some. You may see some of these marks here. Mm-hmm. But these are areas of the body that need these cups. Is bringing that stale, stagnated Melbach waste to the surface and breaking up adhesions, and allowing that tissue to move and be manipulated, where we can get more freedom.
Listen to that man, he's a genius.
So, like cool. These can work independently. They can work with soft tissue. So an example of what we're doing in here is like his shorts, right? This is the muscle. This is the skin around it. His muscles can move. What we're feeling though is it's more like him wearing a wetsuit, and it's like that. So his leg can move, but he's restricted. Less blood flow, circulation, movement. So the cups, and what we're doing is teaching the body to allow that casing to let the muscle get better flow, better energy, movement, range of motion, less work in the body, if that makes sense. And that's the kind of stuff we do here. We specialize in 20-minute sessions, fully clothed, helping you just become aware of the body. And of course, we can do hours, we can do whatever we need to. The big difference is you're coming in, we're talking to you about what's going on, we're looking for the deeper issue, and you're not coming in ordering off a menu, like at a day spa. We're working hand in hand with your particular issue, looking for the root of the problem. His back is his back, his hip is his knee. It's not a protocol for every knee is the same and stuff like that. So we take everybody on a case-by-case basis. I would say that was some of the big differences. I'm sure there's more off the top of my head.
Right on. Thanks, John. My honey's going to be feeling better.